So when it comes to headaches in pregnancy, there are two different types, primary or secondary headaches. Primary are just that they are just a headache all on their own. So these are things like a migraine headache, tension headache, cluster headache, which tends to kind of cluster itself in one spot, often behind one eye or the other. Oftentimes in pregnancy, we're going to see either migraine or tension headaches. Now, the other type of headache is a secondary headache, and that means that a different process is spurring on this headache and causing it to occur. So these can be things like elevated blood pressure, preeclampsia, different neurological events. Those are where something else, another process, is causing the secondary headache to occur. First-line treatment that has no risk is lifestyle modifications, and then different relaxation techniques that may work for you, whether it's aromatherapy or yoga or exercise, things that might make you feel more relaxed and hopefully help either prevent headaches or help to make one that's already present ebb away. Now, the first line recommended treatment for a headache in pregnancy is Tylenol, 1,000 milligrams. Second line recommendation is caffeine. So caffeine is safe if it's used at a low amount. So the cutoff is 200 milligrams of caffeine in a day. And as a third line treatment, you can also try some Benadryl. Benadryl is an antihistamine, it's an H1 blocker. So this can improve headache symptoms, and it can also help with nausea. So if you're in the first trimester and you've got a headache and you're also having some morning sickness, Benadryl might be something that can treat both of those. Now, things not to use. First one that people might think to reach for is any type of NSAID. So NSAID stands for non-steroidal anti-inflammatory drug. Other things not to use is any type of opioid medication. So the following symptoms I'm going to tell you about are indicators that you might be having a secondary headache, meaning that something else is going on that's causing you to experience a headache. So the first one is something called a thunderclap headache. And this is a term because of how rapidly this headache comes on and how severe it is. It feels like there's a clap of thunder in your head. So if you're just fine and then out of the blue, all of a sudden super acute bad headache comes on, that's something to tell your doctor about, versus one where you start to feel a little bit of achiness, things get worse as the day goes on, turns into a migraine, turns into a headache. If you have a headache and you're in the third trimester, it's always a good idea to check your blood pressure. If you have a headache and you're also having blurry vision, if you're having any type of neurological deficits, which is a pretty broad term, remember your brain controls everything in your body. So a neurological deficit can be many things, but if you have a headache and you also have tingling in an arm or a leg, or you feel like you can't move your body appropriately, or anything that pretty much could be associated with your central nervous system, that's something to call about. If you're having any altered consciousness, so you don't know what time of day it is, not sure where you are, feeling disoriented, that's something to call about when you have a headache too. Pretty much call about that anyway, that shouldn't be happening. And at the end of the day, if these things come up and you're not sure, you can always call and talk to a clinician and see if it's something you need to come be evaluated for.